My name is Ehryn. I'm a physiotherapist and a fellow in the Canadian Academy of Manipulative Therapists, or CAMPT-Certified Therapist. I've been an FCAMP therapist for about 6 years now. When I'm not in the clinic treating, one of the things that I love to do is rock climbing. Rock climbing is a physically and mentally demanding sport, and it also takes you to all sorts of beautiful places in the mountains here in Alberta and across the country. So today what we're going to talk about is what they call in the climbing community climber's elbow. Generally this refers to any pain on the inside or the outside of the elbow, sometimes across the back side of the elbow as well. You'll hear these conditions referred to also as tennis elbow or golfer's elbow, or here in the clinic you're likely to be diagnosed with what we call either medial or lateral epicondylitis. Within climbing, there's an extreme amount of stress that goes through the flexor and extensor muscles in the forearm, and so these are the muscles that move your wrist forward and move your wrist backwards. And though they sort of control your hand and your wrist, they actually originate up around the elbow, and that's the structure that's typically involved in climber's elbow. And so as an FCAMP therapist, I can help you get better, recover faster, and stay healthier. What we would want to do first is diagnose exactly which structure is involved in your problem and causing the pain that you're having in your elbow. What we would do then is we would apply manipulative therapy techniques to the elbow, as well as come up with an appropriate exercise program and try to find some of the things that might be leading to the development of this elbow pain. A lot of time in new climbers or intermediate climbers, we'll see that you're over gripping, or if it's your first time outdoors, maybe we're a little bit more scared, so we're pulling on things a little bit harder, so we see that a lot. Or if we're sort of climbing with the elbows bent, as opposed to getting those arms nice and stretched out as we're climbing. So again, what we want to do is in the clinic, diagnose that, get you on an appropriate program to get you back on the wall and ready to send that next project. So if you're a climber here in Edmonton, or anybody who's got elbow pain, you can find me down here at Corona Station Physical Therapy. If you're not in Edmonton, find yourself an FCAMP therapist and they can help you get back to the things that you love doing.
CAMPT-Certified Physiotherapists have received internationally recognized training in hands-on therapy. We can help you get better, recover faster, and stay healthier. So if you want to stay active in the things you love to do, then look for this logo. For more information on how to find a CAMPT-Certified Physiotherapist, visit www.manippt.org.